Hi guys, welcome to this session. So we are going to start the questions. Can you see the first one? A 31 years old female with Graves' disease. What's the problem of this patient? The problem of this patient, she is having Graves' disease. Clear? She underwent total thyroidectomy, right? And there is hoarseness of voice and there is stridor due to recurrent laryngeal nerve injury. Can you tell me what is the most common site of injury to the recurrent laryngeal nerve? Guys, tell me what's the correct answer here. So correct answer here is at the here the recurrent laryngeal nerve is most commonly injured near inferior thyroid artery. So what is the correct answer here? It is inferior thyroid artery. Clear? So correct answer is option D, right? So what is the correct answer here? Correct answer is option D. That's option D. Clear? So it's option D. Now you can see the next question. Okay. Question number 2. A 55 years old woman presents with enlarging, hard and fixed. Can you see this? It's enlarging, hard and fixed thyroid mass, and there is neck discomfort. This patient is having difficulty in swallowing. So what is the problem? She is having hard mass in the thyroid. On examination, the thyroid gland feels rock hard with no tenderness. Ultrasound of thyroid shows extensive fibrosis. What is the most likely diagnosis? Can anybody tell me? So guys, this is Riedel's thyroiditis. And what is the other name of Riedel's thyroiditis? This is invasive fibrous thyroiditis. So what is this? This is invasive fibrous thyroiditis. Clear? So this is invasive fibrous thyroiditis. Okay. So what's the name? This is invasive fibrous thyroiditis, and that is also known as Riedel's thyroiditis. So that is invasive fibrous thyroiditis. Invasive fibrous thyroiditis. Clear? It is invasive fibrous thyroiditis, that is Riedel's thyroiditis. आपको पता है what's the problem in Riedel's thyroiditis? There is complete replacement of thyroid and parathyroid by fibrous tissue. So ultimately what will happen? Complete replacement of thyroid and parathyroid by fibrous tissue. So what will happen? Patient is going to develop permanent hypothyroidism and permanent hypoparathyroidism. So what will happen here? You can see this is the thyroid gland. Whenever it is replaced by fibrous tissue, what's the problem? Replaced by fibrous tissue, yes, it becomes hard and woody. And since it becomes hard and woody, it is going to compress the midline structures. What are those midline structures? Can you tell me? Trachea, esophagus and recurrent laryngeal nerve. And because of compression of all these midline structures, what the patient will be having? Tell me. Dyspnea, dysphagia, hoarseness of voice. Important point here, you cannot make the diagnosis by FNAC. Here it is diagnosed by biopsy. What is the problem? Patient is going to develop permanent. What is the problem? Patient develops permanent hypothyroidism. Clear? So there is permanent hypothyroidism and there is permanent hypoparathyroidism. Guys, can you tell me how will you manage permanent hypothyroidism and permanent hypoparathyroidism? Tell me. Permanent hypothyroidism, you have to give lifelong levothyroxine, and permanent hypoparathyroidism, what you have to give? Lifelong calcium and vitamin D. Got it? So this is Riedel's thyroiditis. It is also known as invasive fibrous thyroiditis. What is the problem in Hashimoto's thyroiditis? You know, it leads to hypothyroidism, but thyroid is not hard and woody. What is the problem in De Quervain's thyroiditis? Subacute thyroiditis, also known as viral thyroiditis, also known as granulomatous thyroiditis. And there is another thyroiditis known as painless or silent thyroiditis. So here, what is the correct answer? The correct answer is option A. Clear? So what is the correct answer? Correct answer is option A. Okay? So correct answer, that's option A. Next question you can see. Next question you can see here. So you can see question number 3. Right? A 65 years old man presents with hard unilateral breast lump. Can you tell me patient is male or female? Man. A 65 years old man, and this man is having hard and unilateral breast lump. Right? There is nipple retraction also. And if there is nipple retraction, guys, can you tell me what's the diagnosis here? So can you tell me the diagnosis? This patient is having breast cancer. Clinical examination reveals you can see here The clinical examination reveals skin dimpling and there is axillary lymphadenopathy. So, patient is having breast cancer, there is dimpling and there is involvement of lymph node. So, what is the diagnosis? Diagnosis is male breast cancer. Can you see this? Patient is having male breast cancer. Okay? Male breast cancer. Which of the following is wrong? Wrong about this condition. You know, in males and females, which mutation is responsible? Both BRCA1 and BRCA2 are responsible for breast cancer in both males and females. You know, BRCA1 mainly in females, BRCA2 mainly in males. और आपको पता है how to remember, ladies first. So BRCA1 mainly in females, BRCA2 mainly in males. Mainly in males. So this option is correct. Second, what is the age of malignancy? Can you tell me one of the most important risk factor for malignancy? Boliye, it's age. And what is the age, guys? Tell me, 6th decade. So here it is most common in which age group? It is most common in 6th decade. Remember, around 60. So it is most common in 6th decade. This is incorrect. Poor prognosis compared to carcinoma breast in females. Yes, why? Because in females what happens? Yes, see, females have breast tissue. That's why what will happen, if there is malignancy, it takes time to involve nearby structures like chest wall. In males, there is scanty breast tissue, and whenever there is scanty breast tissue, what is the big problem in males? Can you tell me? There is early involvement. So if there is early involvement, relatively males are going to present late and there is poor prognosis. Why? Because कोई भी मेल है, वो मेल कभी भी ऐसा नहीं सोचेगा कि उसको breast cancer हो जाएगा. A male can imagine that he might be having HIV, but he will not imagine that he will have breast cancer. And if patient is going to notice breast cancer, what? There is delay in presentation. So relatively the prognosis is poor. And what is the most common type in males as well as in females? The most common type of breast cancer is same. And what's that? Invasive ductal cancer. So in both of these, the most common type is invasive ductal cancer. So what is the correct answer, guys? Option B is incorrect. So option B is incorrect and that's the correct answer. Clear? So option B, that's the correct answer. Next question. Question number 4. 28 years old lactating mother, right? She is having fever. There is breast pain, swelling, tender erythematous area on her left breast. Can you tell me, she is lactating, and if she is lactating female, guys, can you tell me the diagnosis? Patient is having breast abscess. There is pus filled cavity. Yes, Kashyap, you are correct. So what would be the initial treatment? Whenever initially patient is going to have abscess, we are going to start antibiotics. What is the treatment of choice? Whenever there is well defined abscess and the cavity is huge, you go for IND plus antibiotics. Now see the options. Close observation, no. You have to start antibiotics at least. Second, antibiotics and breast emptying, correct. Hormonal therapy, incorrect. Surgical excision, incorrect. So can you tell me what is the most common organism responsible? Yes, you know, the most common organism responsible, Staph aureus. So guys, you know, the most common organism responsible, that is Staph aureus. And what is the first line agent against Staph aureus? Yes, we are giving cloxacillin. So name of agent, we are giving cloxacillin or dicloxacillin. Okay? So we are giving cloxacillin or dicloxacillin for how many days? We are giving it for 10 to 14 days. So cloxa or dicloxacillin, it is given for 10 to 14 days. So here, what is the correct answer? Correct answer is option B. Okay? Next question. Question number 5. Very easy question. Read it. 45 years old woman diagnosed with early stage breast cancer. She opts for surgery that involves removal of entire breast, including nipple, areola, but not the axillary lymph node. What is the type of mastectomy? Let me tell you, it's very, very easy. Can you see? This is breast. Can you see this? This is nipple. This is areola. Okay? Can you see this mass? Got it? Suppose I am giving incision. What kind of incision is given? You can see this kind of elliptical incision. And when you give elliptical incision, what organs are removed? Can you say, tell me? I am going to remove nipple, areola, skin, breast tissue, breast mass. It's the nipple, areola, skin, breast tissue, breast mass. What is the name of this mastectomy? Simple mastectomy. Apart from simple mastectomy, you remove level 1 lymph node, that is known as extended mastectomy. Apart from simple mastectomy, remove level 1, level 2 lymph node, that is modified radical mastectomy. Apart from simple mastectomy, if you remove 1, 2, 3, level 1, 2, 3 lymph node, you also excise pectoralis major as well as minor, that is known as Halsted radical mastectomy. Here you are not removing any lymph node, so obviously what's the name? So what? Total or simple mastectomy. You know, simple mastectomy is also known as total mastectomy. Clear? Correct answer is option A. Next, very easy. Which of the following describes the basal type of breast cancer? What do you mean by basal type of breast cancer? Basal type is very easy. This is triple negative breast cancer. And if it is triple negative, all these are negative. So ER negative, PR negative, HER2 negative. So this is triple negative breast cancer, also known as TNBC, right? This is also known as basal type. So this is also known as basal type. Quickly, I am going to discuss the types of breast cancer. This criteria is known as luminal criteria. And what is the name? This is known as molecular classification. Can you see this? So this is molecular classification of breast cancer, okay? So this is molecular classification of breast cancer, okay? It is based on gene expression profiling. What is the other name? Luminal criteria. In this case, you can see LUM A. What is LUM A? It is ER positive, PR positive, HER2 negative, double positive. Remember, this is the most common type having best prognosis. What is LUM B? LUM B is triple positive, ER positive, PR positive, HER2 positive, right? Normal breast like ER negative positive, well differentiated. And we discussed this one. This is very important. Basal cell type. How to remember? It is triple negative. If it is triple negative, इसका मतलब तीनों negative होगा. ER भी, PR भी, HER2. So ER, PR, HER2, all these are negative. All these are negative. And most important point, worst prognosis. Worst, right? After that, HER2 type. So obviously HER2 type, only HER2 is positive. Let me discuss the question. They ask which one is most common? LUM A. Which one is having best prognosis? LUM A. Which one is having worst prognosis? Basal cell type or triple negative breast cancer. And since it is triple negative, all these are negative. You got it? So all these are negative. Clear? Next, very easy question. Guys, see, this easy question and important. There is integration between surgery and pathology. 6 years old boy, can you tell me what is the most common soft tissue sarcoma in children? Easy question, guys, tell me. Easiest. Most common type of soft tissue sarcoma in children, you already know, rhabdomyosarcoma. There is rapidly growing 3 cm mass in right cheek. Biopsy में आपको क्या दिख रहा है? Small round blue cells, alveolar pattern, eosinophilic cytoplasm, cross striations and positive immunohistochemistry for desmin and myogenin. And if it is positive for desmin and myogenin, you know, these are positive in rhabdomyosarcoma. Clear? So it is positive in rhabdomyosarcoma here. What is the correct answer? Correct answer is option C. Patient is having rhabdomyosarcoma. In this image also you can notice that these are small round blue cells. There is alveolar pattern, eosinophilic cytoplasm. क्या है ये? Rhabdomyosarcoma. What is the special question asked in relation to rhabdomyosarcoma? Remember, this is most common soft tissue sarcoma in children. So most common soft tissue sarcoma in children, that is rhabdomyosarcoma. Clear? Next question, easiest. Unresectable metastatic dermatofibrosarcoma protuberance, which targeted therapy is considered as drug of choice? Easiest question. It is DFSP. You know, dermatofibrosarcoma protuberance. Obviously, we go for wide local excision, and usually we take margin of 2 to 4 centimeter. We excise the underlying fascia also. Why? Because it is having, you know, extension beyond the margin, beyond the tumor. So there is high risk of local recurrence. Now see, now let me tell you, there is one drug which is highly effective. In which cases? It is highly effective in GIST. Clear? It is highly effective in CML, chronic myeloid leukemia, and the same drug is given in DFSP. Guys, tell me, this is the biggest clue. Which drug is common? Given in GIST, it is given in chronic myeloid leukemia and dermatofibrosarcoma protuberance. Answer is same. In all these cases, we are giving the same drug. So, we are giving imatinib. Which drug we are giving, guys? We are giving imatinib. So, what is the correct answer here? Correct answer is option B, that is imatinib. Easy? Imatinib. Next question, very, very easy. Read this question, first see the patient. Can you see this patient? This patient is having bilateral cleft lip, and in this case, can you see this is maxillary process? Can you see this? This patient is having maxillary process, and can you see this? This is medial nasal process. Median nasal process. So, this is maxillary process, this is median nasal process. Now, read the question, very easy to understand. 3-day-old male neonate brought to you by his parents, concerned about the appearance of his face. On examination, neonate has the appearance as shown in the image, means patient is having bilateral. Can you see this? This child is having bilateral cleft lip. You can see child is having bilateral cleft lip. Cleft lip. Which of the following embryological events is most likely responsible for this defect? Option A, failure of fusion between lateral palatine process and nasal septum. No, this is for cleft palate. Non-fusion of maxillary prominences and medial nasal prominence. Yes, it's correct. Correct. So, this is option B. That's correct. Option C, incomplete fusion of mandibular prominence. This is incorrect because this is for lower lip. Non-fusion of lateral nasal prominence and medial nasal prominences. This is incorrect. So, what is the correct answer here? Option B. थोड़ा सा हम लोग देख लेते हैं about cleft lip. Yes. What is the cause of cleft lip, guys? Tell me. If it's unilateral, you can see here this is maxillary process, and you can see this one. This is medial nasal process. Can you see this? So, whenever it's unilateral, what happens? There is failure of fusion of maxillary process and medial nasal process. But whenever it's bilateral, can you see? Failure of fusion of maxillary process and medial nasal process bilaterally. तो आप देख सकते हैं this is unilateral cleft lip and this one is bilateral cleft lip. Clear? Now see the next question. Question number 10. Very easy. 3 months old female infant. She's 3 month old. Okay. There is feeding difficulties and noticeable facial deformity. On examination, infant has unilateral complete cleft involving left lip, extending through alveolus and hard palate, with an intact soft palate on left side. Right side of lip and palate completely intact. What is LAHSAL classification? I am waiting for your reply, guys. Tell me what's the correct answer. Let me see who is the genius over here. Though this topic is not asked frequently, but actually it was asked in INI-CET 2 to 3 times. Okay, let me discuss it first, then we will discuss the question. What is LAHSAL classification? Very easy. What is LAHSAL? Can you see? L is for lip. Can you see? Right lip L, then right alveolus A, hard palate, soft palate, and then left alveolus, left lip. Easy. So you can see this is right lip, alveolus. इसके बाद hard palate, soft palate. After that alveolus, and this is left lip. Clear? Now how to identify? If patient is having complete cleft, it is designated by capital letter. If incomplete cleft, it is designated by small letter, and if there is no cleft, we are going to place a dot. Let me discuss with example. Imagine a patient is having cleft lip as well as cleft palate of soft palate and hard palate. So, if a patient is involving cleft lip, cleft palate, soft and hard, there is involvement of alveolus also, both right and left. So, it is LAHSAL. Now, imagine this patient is having no cleft lip on the right side. If there is no cleft on the right side, dot. No cleft of alveolus on the right side, dot. Clear? No cleft of hard palate, dot. No cleft of soft palate, dot. No cleft of alveolus, dot. Only cleft of lip. what? L. Yes. So what you are going to see 5 dots and after that L. Clear? In this question, what was the problem? Yes, write down LAHSAL. Right? On the right lip, on the right side of lip, no cleft. Dot. Alveolus, no cleft. Dot. In hard palate, there was complete cleft. Clear? Complete cleft. In soft palate, no cleft. In alveolus, there was complete cleft in alveolus. Lip, complete cleft. So what is the correct answer? Correct answer is dot dot H dot A dot L. Guys, I'm asking this question again. How many of you didn't understand? Tell me in the comment box. How many of you didn't understand? I'm repeating. Okay? I'm repeating it again. Clear, guys? Okay, I'm repeating it again. Very easy. Okay? Let's write everything again. Okay? This patient is having lip, right, left. Okay? There is alveolus, hard palate, soft palate. What you do? You just write LAHSAL. Write it. You write it LAHSAL. If patient is having cleft of right lip, cleft of alveolus, cleft of hard palate, cleft of soft palate, cleft of alveolus on the left side, cleft of left lip, and these are complete, it should be written in capital letters. Anywhere there is no cleft, we are going to use dot. So suppose on the right side in the lip and alveolus, no cleft, put a dot. Alveolus, dot. There is hard palate, cleft, hard palate. What kind of? Complete, H. If it is incomplete, small h. Soft palate, if there is cleft, write capital S. If there is no cleft, write a dot. Alveolus, there is cleft, capital A. If it is incomplete, small a. Left lip, if it is cleft of left lip, capital L. No cleft, a dot, or incomplete cleft, L. Right? Clear? Now see the question. In this question, what's the problem? You can see there is unilateral complete cleft involving left lip, alveolus, hard palate. So you are going to write LAHSAL. Clear? Where is the cleft, guys? Left lip, L, alveolus, soft palate, no cleft, hard palate, there is cleft, on the right side there is no cleft. So what is this? Dot dot H dot A L. Clear? So this is the correct answer. And what is the correct answer? Option A. Option A. So guys, practice, though it is not asked frequently, but this kind of question was asked in INI-CET. That's why you have to practice. Easy? Clear? Next. Next is very easy. Which of the following statements about Warden's tumor and its diagnostic features is correct? Let me tell you 2-3 basic problems. There are 4 chapters. What are those chapters? Gallbladder, bile duct, thyroid gland, salivary gland. I am repeating. What are those 4 chapters? You can see gallbladder, bile duct, thyroid gland, salivary gland. Okay? So gallbladder, bile duct, thyroid gland, salivary gland. In these disorders, actually most of these disorders are more common in females. Only 2 disorders are more common in males in these chapters. Which 2 disorders? You know, first, primary sclerosing cholangitis. Clear? This is more common in males. And you know, Warden's tumor. Warden's tumor, that is also more common in males. Another feature of Warden's, it can be bilateral. Another feature, it is seen in smokers. Another special feature, all salivary gland tumors, they show cold spot on technetium pertechnetate scan. There is only one tumor which shows hot spot on technetium pertechnetate scan. And can you tell me, कौन सा ऐसा ट्यूमर है जो हॉट स्पॉट देता है on technetium pertechnetate scan? Famous question of INI-CET, and you know, Warden's. So can you see what's the correct answer? Technetium 99 pertechnetate scan showing hot spot is indicative of Warden's tumor. Got it? Clear? So what is the correct answer? B. Remember this special feature, Warden's tumor shows hot spot. Okay? Next. Easy question, easiest question. Again, a famous question asked in INI-CET. Read it. Guys, read the question. 45 years old woman undergoing surgery for removal of submandibular gland mass. Can you see? Post-operatively, she complains of numbness and burning sensation in her tongue. Which nerve is most likely to have been injured during the procedure? Guys, you know that submandibular gland, which two nerves are closely related? One is lingual and the second is hypoglossal. And this question was asked multiple times. Most commonly injured nerve, lingual, followed by hypoglossal. So what is the most commonly injured nerve here? You can see lingual. Another clue that she is having numbness and burning sensation in the tongue. Burning sensation. So remember, most commonly injured is lingual followed by hypoglossal. This is hypoglossal. Here correct answer is option B. Clear? Next. Easiest question, just look at this image. What is this image? All of you know, this is corkscrew appearance, also known as rosary bead, also known as pseudo diverticular appearance. आप सबको पता है ये किस में देखने को मिलता है? It is seen in DES. And what is the condition's name? Diffuse esophageal spasm. Everybody is correct. It is diffuse esophageal spasm. But let me tell you, just by looking at the image, don't mark the answer. Read the question also. So read the question. See, 55 years old man, there is intermittent chest pain. What kind of? Intermittent. And difficulty swallowing for the past 5 months. Chest pain is often severe and mimics angina, not related to exertion. So you know, in diffuse esophageal spasm, because of spasm there is ischemia, and because of ischemia this patient is having left-sided chest pain. Apart from left-sided chest pain, patient is having dysphagia. Symptoms often occur at night. Barium swallow. Typical findings given below. Following disorder. So you know this is DES, special feature of DES. Guys, can you tell me what's the special feature of DES? Yes, this patient is having left-sided chest pain. You know, so patient is having left-sided chest pain and it mimics angina. Apart from that, patient is having dysphagia. Okay? You can see this kind of appearance. What's the name? This is known as corkscrew. So what's the name? This is corkscrew, also known as rosary bead. Clear? Also known as pseudo diverticular appearance. Rosary bead or pseudo diverticular. Clear? So corkscrew, rosary bead, pseudo diverticular appearance. Okay. So what is the correct answer? Correct answer is option D. Okay. Next question. Very easy. Read it and tell me the correct answer. 45 years old male. Can you see this? Presents to emergency department with severe chest pain following forceful vomiting. So any patient after forceful vomiting is having severe pain. Patient is having hematemesis. आप समझ जाइए, या तो बोरहाव है, and if hematemesis is there, painless. If it's painless, it is Mallory Wistia. And if there is pain, cervical subcutaneous emphysema. Yes, this is what? Boerhaave. And what is the name of this triad? Thoracic pain, vomiting, cervical subcutaneous emphysema. Name Mackler's triad. Physical examination reveals subcutaneous emphysema. Most likely diagnosis, everybody is correct. Boerhaave. And you know guys, what is the triad positive? आपको पता है name of triad? Name of triad. ये है Mackler's triad, and all of you know the components of Mackler's triad. That's very easy. And what are the components, guys? Can you tell me? Thoracic pain. So components: thoracic pain, vomiting. So it's vomiting, and what else? Cervical subcutaneous emphysema. So there is cervical subcutaneous emphysema. Emphysema. Okay. Haman's crunch also. Haman's crunch. Clear? So correct answer is option B. Now see, question number 15. Yes, very easy. Read it. Let me see who is the genius over here. For question number 15, let me see who is going to mark the correct answer. Question number 15. 40 years old patient brought to the emergency department. Problem: melena. Patient is having melena and dizziness. Blood pressure 100/80 and pulse rate 100 beats per minute. Laboratory investigation reveals hemoglobin 8 gram per deciliter, blood urea nitrogen 25. Based on Blatchford score, So the question is related to Blatchford score. Which of the following would most significantly increase her risk stratification score? Okay, so guys, let me tell you how to remember. For Blatchford score, we have one mnemonic, and what is the mnemonic? Push. So can you tell me what is push? Push means pulse rate, U means blood urea nitrogen, urea. So it is blood urea nitrogen, S means systolic blood pressure, H means hemoglobin. ठीक है? So it is push, Melina syncope. So it is push, Melina syncope. ठीक है? Cardiac or hepatic dysfunction? Cardiac or hepatic dysfunction. So cardiac or hepatic dysfunction. Hepatic dysfunction. Clear? So it is push, Melina syncope, cardiac or hepatic dysfunction. These are the components of Blatchford score. ये कभी कभी आता है, but it was asked multiple times. I'm repeating. So can you see? Yes, systolic blood pressure less than 100 mmHg. Yes, it is included. High blood urea nitrogen. Yes, it is included. Diagnosis of Mallory-Weiss syndrome, that is not included. Heart rate more than 100 beats per minute included. So correct answer is ABD. It is ABD. Though it is atypical, so let me discuss it in detail. What is this Blatchford score? Yes, tell me. It is risk stratification score for the patients who are having upper GI bleeding. And we discussed how to remember. Can you see? It is push, Melina syncope, cardiac or hepatic dysfunction. So push, pulse rate, U, urea, that is blood urea nitrogen, S, systolic blood pressure, H, hemoglobin, बाकी का Melina syncope, cardiac, hepatic dysfunction. ये याद रहना चाहिए. So this is Blatchford score, and this is the stratification system in the patients of upper GI bleeding to predict mortality and to predict rebleeding risk. ठीक है? Next. Can you see this question, guys? Very easy question. Very easy. 28 years old man presents with recurrent abdominal pain, simultaneously GI bleeding. Imaging studies reveal presence of multiple cysts in the stomach. Medical history reveals paraganglioma, and her mother has history of lung tumor. Yes, what is the most likely genetic syndrome associated with this patient's finding? Yes guys, this is Carney steroid. आप लोग मुझे बताइए, what are the components of Carney steroid? I'm waiting. Yes, Carney steroid, you know, these patients are having multifocal cyst. Okay, what else? Pulmonary chondroma. Can you see the lung tumor? So pulmonary chondroma. And what else? Extra-adrenal paraganglioma. You know, extra-adrenal paraganglioma. Clear? Paraganglioma. So it is extra-adrenal paraganglioma. Got it? So what is the correct answer? Correct answer is option B. Option B. So it's very easy. Okay. Next. Very easy. Which of the following statements is correct? ठीक है, देखिए. What is the most common small bowel tumor in adults? Guys, this is adenocarcinoma. Next question. Most common small bowel tumor in children? It is lymphoma. Next question. Most common primary malignant small bowel tumor is adenocarcinoma. Yes, it is correct. And most common small bowel tumor in adults, you know, adenocarcinoma. Most common small bowel tumor. Yes, if it is malignant tumor, it is adenocarcinoma. Otherwise, it is stromal tumor, guys. If it's benign, it is stromal tumor followed by adenoma, right? And if it is malignant tumor, remember, malignant adenocarcinoma. So what is the most common small bowel tumor in adults? This is stromal tumor followed by adenoma. So that is stromal tumor followed by adenoma. बच्चों में कौन सा होता है? Lymphoma. So let me tell you overall what is the most common malignant tumor of small bowel. Tell me. Adenocarcinoma followed by carcinoma tumor. In children it is lymphoma, and in adults the most common small bowel tumor stromal tumor followed by adenoma. ठीक है, तो यहाँ correct answer क्या है? The correct answer is option C. Next, very easy. Read it and tell me the correct answer. 55 years old patient, radiation enteritis, undergoes bowel resection and develops short bowel syndrome. Which statement about bowel function is correct? What is the correct answer? I am waiting for your reply. Let me give you the clue. Out of jejunum and ileum, which one is having better adaptability? कौन जल्दी adapt कर जाता है? ileum. Ileum is having better adaptability than jejunum. That's why if you resect jejunum, yes, jejunal resections are better tolerated. Why? Because ileum is having better adaptability. ठीक है? Question देखिए. Jejunum compensates well for the loss of ileum. No, it's incorrect. Next question. The ileum can compensate for resected jejunum due to better absorption. Correct. Short bowel syndrome is less severe with distal bowel loss. No. Yes. Ileum compensation is reduced due to looser junction. Yes. This is incorrect. Clear? So, what is the correct answer? Correct answer is that ileum is having better adaptability. It can compensate for the jejunal loss. ठीक है? So, correct answer is option B. So, what is the correct answer here, guys? Correct answer is option B. Next, very easy, easiest by common sense also you can mark the correct answer. Read it. 72 years old multiparous woman. Problem: painless mass protruding from her anus along with occasional bleeding and fecal incontinence. On examination, mass is circumferential. Got it? Red in color and reducible. So, this mass is coming out circumferential. Remember, if there is hemorrhoid, hemorrhoid is like this. What is the shape of hemorrhoid? Hemorrhoid is trifoliate. Can you tell me? At 3 o'clock, at 7 o'clock, at 11 o'clock. But if it is circumferential, it means it's rectal prolapse. All three layers are coming. Patient is an adult, and you know, in adults, what kind of rectal prolapse is there? Full thickness. So, is it partial prolapse? No. Is it mucosal prolapse? No. It is seen in children. Is it internal hemorrhoid? No, because it is trifoliate. This one is trifoliate. What is the correct answer? So, you can see the correct answer is option C. Option C. Why it is complete? Because all three layers are coming. What? Mucosa plus submucosa plus muscularis propria. Since all three layers are coming, mucosa, submucosa, muscularis propria, so this is complete prolapse. Complete. Okay? Next, very easy. Tell me guys, what's the correct answer? Question number 20. 35 years old woman experiencing severe pain during bowel movements, bright red blood on the toilet paper, chronic anal fissure, not improved with conservative management, being referred for surgery. Which surgical procedure aimed at reducing anal sphincter tone to promote healing of the fissure while maintaining the continence? Everybody is correct. What you do guys, here there is spasm of internal anal sphincter. What you do, you cut the sphincter laterally and you perform lateral sphincterotomy. So, what is the treatment here? Lateral internal sphincterotomy. That's the correct answer. Okay? So, what we do? We perform lateral internal sphincterotomy. Okay? Next, 21. Very easy. 28 years old male. He is having right lower quadrant pain, nausea, low grade fever. Upon examination, there is rebound tenderness at McBurney's point. Which of the following is most likely initial event in the pathogenesis of patient condition? Guys, can you tell me what is the diagnosis? Everybody knows this is acute appendicitis. Patient is suffering from acute appendicitis. And you know what is the problem? This is the patient. Can you see? This is the appendix. You can see this is the blood supply. In the lumen, what's the problem guys? Luminal obstruction. And can you tell me what is the most common obstruction? Absolutely correct. So, what is the most common cause of obstruction? Fecolith. So, it is because of obstruction of the lumen. So, what's the correct answer? It's because of obstruction of the lumen. Okay, easy. Next question देखिए, very easy question. Just look at the image. If you see the image, guys, can you tell me what is 1? If you see type number 1, What is the name of this incision? Guys, you know, this is McBurney's incision. What is number 2? This is Rutherford-Morrison incision. Number 3, that is Lange incision. Number 4, that is Battle incision. Battle incision. So can you see? 1 McBurney's, 2 Rutherford-Morrison, 3 Lange, 4 Battle. So what is the correct answer? You can see the correct answer. Correct answer is option D. By the way, let's read the question also. I discussed. Question पढ़ लेते पहले. So let's read the question. Okay, read it. 25 years old male having right lower quadrant pain. Easy. Diagnosed with acute appendicitis. Surgical team plans to perform an appendectomy. Which of the following correctly represents type of incision used in appendectomy? So can you tell me what is number 1? We discussed. Yes, number 1. Number 1 is C, McBurney's. What is number 2? Number 2 is Rutherford-Morrison incision, A. Number 3, that is Lange. And what is number 4? Is Battle. Clear? It's Battle. So what is the correct answer? Option D. आजकल incision काफ़ी पूछा जाता है, and let me tell you the incisions, abdominal incisions, very very easy and important. आप देख सकते हैं, we already discussed incisions related to appendix, McBurney's, Rutherford-Morrison, Lange. One question is for all of you. Out of these 3 incisions, can you tell me only one is muscle cutting? Tell me which one. Yes, if it is not Battle, अगर Battle नहीं है, so you can see it is just by the side of midline. अगर midline के बगल में है, you can mark paramedian. Okay, so only one incision which is muscle cutting, you know, it is Rutherford-Morrison. This is Rutherford-Morrison. This is muscle cutting first. Sometimes what happens in exam, Battle incision is not given. If Battle incision is not given, if you give incision, yes, midline, that is midline incision, और midline के हल्का सा side से incision देंगे, that is paramedian. But remember, this paramedian should not be in infraumbilical region. Usually, paramedian should be long incision. This is for accessing the peritoneal cavity. और अगर छोटा है infraumbilical region में, so that is Battle. Okay, and you can see Cocker's or subcostal incision for cholecystectomy, and आप देख सकते हैं cesarean के लिए we have phalangeal incision. So these are the questions related to incisions. It's very very important. Next, guys, tell me what's the correct answer here? Easy question. Actually, this is asked in medicine and pharma. बोलिए, 32 years old patient having mild Crohn's disease affecting ileocecal region presents to your clinic. Patient has mild symptoms with no significant systemic involvement. Okay, most appropriate first line drug to prescribe to induce remission. Can you tell me what is the first line agent for inducing remission? Guys, tell me. We are not using prednisone, guys. Examiner is asking first line and patient is having mild Crohn's disease. We are using budesonide. We are not using prednisone. We are using budesonide. Okay, let me discuss. You guys are not very sure, so let me discuss. Patients who are having mild to moderate Crohn's disease, for inducing remission, we are giving budesonide, and for maintenance therapy, sulfasalazine. Imagine after sulfasalazine there is no improvement, then give prednisone. And if patient is steroid dependent, in that case we are using azathioprine, 6-mercaptopurine or methotrexate for maintenance of remission in active Crohn's disease. और मान लीजिए इसको भी रिस्पॉन्ड नहीं करता, patient is refractory to 6-mercaptopurine azathioprine, then we give TNF alpha agents, what? Infliximab, adalimumab, certolizumab, pegol. Clear? So remember, for mild to moderate Crohn's disease, for inducing remission, we are giving budesonide, and for maintenance therapy, what we give? Sulfasalazine. ठीक है? So we are giving sulfasalazine. Okay, guys? Next. Easiest question. All of you know what's the problem in ulcerative colitis. See, this is the patient. Okay, guys? Patient. In this case, what's the problem? You can see the disease starts from rectum. Clear? Disease starts from rectum and it moves cranially upwards. When it moves cranially upwards, it is going to involve sigmoid colon, descending colon, transverse colon. It is having continuous lesions. If there are continuous lesions, आप क्या कर सकते हैं, आप पूरा colon हटा दीजिए, पूरा rectum हटा दीजिए. So what is the treatment of choice? Remove the whole colon, remove the whole rectum, and name of surgery TPC. All of you know what is this TPC? This is total proctocolectomy, right? So total proctocolectomy plus we go for IPAA. And what is this IPAA? That is ileal pouch anal anastomosis. So what is the correct answer? End ileostomy, that's not the treatment of choice. This is the treatment of choice. So it is total proctocolectomy plus ileal pouch anal anastomosis, and that's the treatment. Clear? So that's the treatment. Next. Guys, this question is very easy. आप लोग बताइए what's the correct answer? 45 years old man, history of abdominal surgery. ठीक है? Presents with severe crampy pain and bilious vomiting. Can you tell me the diagnosis? Crampy pain, bilious vomiting. It means patient is having small bowel obstruction. Next. Abdomen is distended. Not had bowel movements for 3 days. Can you see? Which of the following is most likely cause? Most likely cause, patient had history of abdominal surgery. There was history of abdominal surgery. Easy. Crampy pain. Guys, in paralytic ileus, crampy pain or colicky pain is not there. Whenever there is mechanical obstruction, then only there is colicky pain. So there was history of previous surgery. Most common cause of small bowel obstruction, that is adhesions, right? So this patient is having what? Adhesions. Which one? Pelvic adhesions. Why it's not colorectal cancer? Because patient is having small bowel obstruction. It's not hernia. It's not Crohn's disease because patient had surgery. Patient had surgery. That's why correct answer क्या है बोलिए? Adhesions leading to small bowel obstruction. याद रहेगा सबको? Adhesions leading to small bowel obstruction. ठीक है? अगला देखिए आप लोग. It's very very easy guys. Very easy. Can you see the next question? See and tell me. First tell me what's the name of this appearance. All of you know that this is coffee bean sign. And if it is coffee bean sign, obviously patient is suffering from what? Sigmoid volvulus. Can you see this? So coffee bean, patient is having sigmoid volvulus. Now the question is asked in relation to sigmoid volvulus. एक बार देखिए आप लोग. 72 years old male, 2 days history of progressive abdominal distension, constipation, colicky pain. History of chronic constipation. Bedridden for past 5 months due to hip fracture. Abdomen is distended and tympanic, mild tenderness. Guarding and rigidity not absorbed, it means not observed, it means there is no peritonitis. X-ray shown below and you can see coffee bean sign. Patient is having coffee bean. Coffee bean sign. Which of the following factor does not predispose to this condition? Tell me. So there are 2 mandatory factors for sigmoid volvulus, 2 factors. One, constipation, and the second, patients who are having long narrow mesentery. What kind of mesentery? Long and narrow. See the first one, chronic constipation with laxative abuse. Yes, is a risk factor. Anticholinergic side effect or anticholinergic drugs. Yes, these drugs are going to impair the peristalsis. Correct. Mentally retarded individuals. Why? They take antipsychotics. Antipsychotics are having what? Anticholinergic side effects. It is correct. D option is short pelvic mesocolon. No, it's long narrow mesentery. So it's long narrow mesocolon. So it's long and narrow, not the short. So what is the correct answer? Correct answer is D. Clear? So guys, it's D. थोड़ा सा मैं डिस्कस कर लेता हूँ. देखिए, sigmoid volvulus, this is the most common site of volvulus. You know, it is anti-clockwise. Constipation, long narrow mesentery, and we discuss the risk factors. Anything which can cause constipation like old age, hospitalized patients, mentally impaired patients, and patients who are taking the drugs which are having anticholinergic side effects like opiates and antipsychotics. ठीक है, next ये देखिए, it's very easy guys. Can you tell me what's the correct answer here? Correct answer, 52 years old woman, abdominal distension, colicky pain worsens after meals. There is gradual decline in her overall health. On examination, there are multiple hernias. Ascites do not demonstrate shifting dullness. If ascites is not having shifting dullness, it means there is collection of semi-solid in the peritoneal cavity. And if there is collection of semi-solid in the peritoneal cavity, it is actually jelly-like substance. And what is that jelly-like substance? Patient is having pseudomyxoma peritonei. Why this patient is having multiple hernia? Because of collection of jelly-like substance, there is increased intra-abdominal pressure. Because of increased intra-abdominal pressure, this patient will be having multiple hernias. Next, jelly-like substance throughout the peritoneal cavity and mesentery, most likely diagnosis pseudomyxoma peritonei. Now one question for all of you, आप लोग बताइए, what is the most common primary for pseudomyxoma peritonei? Tell me. For pseudomyxoma peritonei, what is most common primary? कहाँ से आता है ट्यूमर? Patient is having, it is caused by mucinous adenocarcinoma. ठीक है? So this is mucinous adenocarcinoma, and what is the most common primary? Appendix followed by ovary. So you know the most common primary, that's appendix followed by ovary. Clear? So this is appendix followed by ovary. What's the correct answer? Correct answer is option B. ठीक है? Next, very easy. Question number 28. Male patient, there is bilateral flank pain, lower extremity edema, elevated serum creatinine, CT scan, retroperitoneal mass encasing both ureter, biopsy, dense fibrocollagenous tissue and chronic inflammation. Which of the following is most likely etiology? Guys, tell me, it's very easy. Can you see here? Patient is having dense fibrocollagenous tissue and chronic inflammation. Remember, patient is having chronic inflammation. Actually speaking, this patient is having IgG4 related retroperitoneal fibrosis. Remember, this is very, very important. This patient is having IgG4 related retroperitoneal fibrosis, and in this retroperitoneal fibrosis, three structures are involved. Most commonly, ureter. Since ureter is involved, that's why there is raised urea and creatinine. Patient will be having bilateral hydronephrosis. Agla, there is involvement of IVC. If IVC is compressed, what will happen? Bilateral edema. And in some cases, there can be compression of aorta. It's compression of aorta. So this patient is having IgG4 mediated retroperitoneal fibrosis. ठीक है? So correct answer is option A. This is option A. Next, अगला क्वेश्चन आप लोग देखिए, क्वेश्चन नंबर 29. 65 years old male, there is acute lower GI bleeding, hemodynamically stable, but significant amount of blood is there in the stool. First tell me, patient is stable but significant bleeding is occurring. Are you going to discharge the patient? Obviously not. You are going to admit the patient. When you are going to admit the patient, you are going to visualize the colon, that what is the source of bleeding, where is the bleeding. तो क्या करेंगे बताइए? What is the next best step? Yes, go for colonoscopy. Outpatient? Obviously not. Don't discharge. Immediate surgery? Without diagnosis, avoid doing surgery. CT angiogram? Obviously not. क्या करेंगे? Inpatient colonoscopy. We are going for inpatient colonoscopy. ठीक है? Correct answer is option D. Next question, very easy. 15 years old patient diagnosed with juvenile polyposis syndrome, JPS. Okay? Which of the following statement accurately describes management and characteristic of JPS? Tell me, initial colonoscopic screening should be started at what age? Guys, it's not 10. At what age we are going to start? Can you tell me? It should be started at 12 to 15 years. So it is started at 12 to 15, not at 10. Okay? JPS is caused by mutation in SMAD4 or BMPR1A gene. Correct. prophylactic colectomy is indicated only when iron deficiency anemia is present. No, iron deficiency anemia, dysplasia, or patients who are having high polyp burden. High polyp burden, in all these cases, we are going for prophylactic colectomy. This is also incorrect. Best manage with immediate total colectomy regardless of number of polyps. No, we are not going for immediate colectomy. So which one is correct here, guys? JPS, it is caused by mutation in SMAD4 or BMPR1A gene. Clear? Correct answer is what? Option B.